Good morning, everyone.
Morning.
So we're very excited to have another episode of Aging in Action, and we have a very special guest with us today. Well, we have Sue Vanderbent, the CEO of Home Care Ontario, with us today. Welcome, Sue.
Hi, Sue.
Thank you, Nikki.
Hi, Sue.
Hi, Gwen. Hi, Joy.
So, Sue, why don't we start off here, and why don't you tell us and our audience a little bit about yourself and your role with Home Care Ontario?
Sure, happy to do that, Nikki. So my name is Sue Vanderbent. I'm a social worker by profession, and I've been a social worker for many, many years. I started out in the hospital system, but I have done work in all kinds of parts of the healthcare system. I've worked in psychiatry, in surgery, in medicine, and mental health and addictions. I started the first women's detox here in Hamilton. When I started my career, I did many lectures on suicide prevention because I worked on a suicide unit. I have been very involved in my church. I've done a big restoration for my big 160-year-old church a couple of years ago. I'm on the Empire Club board, and I help bring speakers from everywhere to speak to Canadians about who are big speakers that they might want to hear about. I teach at McMaster University and have taught at McMaster in the medical school. I teach communication skills to medical students. So I've had a very big career in terms of experiences, and several years ago I left the acute care system and I started to work in home care, because when I was the director of social work and professional practice at St. Joe's here in Hamilton, all I saw really was the need for a better home care system. So I left the hospital and I came to Home Care Ontario. At that time it was called the Home Care Ontario Association, but we changed it. And so we started this journey of trying to help people get more home care. Today, across Ontario, it's a huge sector. We're delivering at about 750,000 people get about almost 40 million hours of care a year. Mm-hmm. And then people are both publicly funded to receive home care. There's a big publicly funded system, and there's a growing, really important sector, which I consider to be family funded. So families are funding their own care to support their moms and dads, because our publicly funded system, sadly, is still not as broad and as big as it should be to help people. Maybe that's a start, Nikki.
That's a great start.
Yeah.
You're a busy person.
So,
I can only imagine all the experience you have in this healthcare sector, the value that you bring to Home Care Ontario. And I think maybe talk a little bit about what is Home Care Ontario for our audience.
Right. So thanks. Home Care Ontario is a provincial association. So we are like many other provincial associations. Like you've heard of the Ontario Hospital Association, Ontario Long-Term Care Association. There's associations of family medicine. Every practice, every profession has an association. And the role of the association is really to speak to government and to speak to the public. So we have that dual role of speaking to government and say, look, we need to have more home care for people that is publicly funded. And we speak to the federal government as well, because healthcare is both federally and provincially funded. And then we have a big role in terms of producing research papers. We do a lot of public speaking. I do quite a bit of public speaking and educate everybody about what is home care and how can it help you. And in fact, I was just talking to Gwen and Joy ahead of time about the fact that a lot of people don't even know that a home care system exists that is both publicly funded and family funded, and that people need it. If they come out of the hospital, let's say somebody's coming out of the hospital after a big surgery, they often get home care. They almost always do get home care. If they're struggling with chemotherapy in the home, that's a home care. If they're getting renal dialysis, like kidney dialysis, that's home care. At the same time, if they're just experiencing frailty and need help having a bath, need help making some food, need help with some of their personal care, that's home care. So
and
it's huge.
I was just going to say, and it's not all seniors. We always
No.
sort of associate home care with seniors, but it's anybody who needs care at home.
Exactly, Gwen. And a lot of people don't understand what that really means. But every day, somebody is receiving home care. People who are end-stage cancer patients are receiving chemotherapy at home from a nurse. They're receiving OT, occupational therapy, maybe physiotherapy, social work. The family needs help, and so does the person. But maybe that's just a person who is 95 years old and wants to stay at home.
Mm-hmm.
Right? And they have no real physical problems, but they need support and help, and they need not to be isolated. That's home care.
Yeah. Go ahead.
So Sue, earlier on, you mentioned publicly funded and family funded. So can you just maybe explain to us, like, what's the difference?
So the province of Ontario has publicly funded home care. And right now that's administered through the LHINs, the Local Health Integrated Networks. And there's a big system transformation taking place that perhaps a lot of Ontarians don't know about. But for now, it is the LHINs, and a person would call the LHIN in your area, and they would ask for an assessment. Like you could call on behalf of your mom, or your dad, or your child, or your son.
What is a LHIN? Sorry, I just want to interrupt. But what is a LHIN? What is that?
It's they're called Local Health Integration Networks.
Okay.
And these are organizations that are across the province for different areas. And what they basically do is they assess, they have care coordinators who assess the care so Gwen, let's say you were calling on behalf of your dad, the care coordinator would come in and assess you and your dad, and then they would say, yes, Mr. Price, or your dad's name, needs a personal support worker. He needs some help bathing. He needs some help with his, this wound. If he's come out of the hospital, say he's had a hernia, let's say a hernia surgery, he needs a nurse to come in and dress his wound. And we will send that person in, and that person, that nurse or that personal support worker, comes from one of the organizations that the LHINs have chosen to provide care in your area. So that's
one of the things we were talking about, and I was saying when my dad, in the last part of his life, we promised he'd stay at home, so we did need help. Thankfully, my sister was a retired nurse who knew how to navigate all this. She used to work with some of the people involved, because I thought that was my mother in her 80s or 90s having to do this. It would have been so daunting to even call a 1-800 number, right? So how, sometimes you just don't know. You want to keep people at home as long as possible, but it just seems like such an overwhelming thing to go through.
Right. And so, Gwen, the publicly funded system will support you. And then there's always limits, because there's so many people on the publicly funded side, right? We're talking about 750,000 people. However, we know that there's about 150,000 Ontarians who are funding their own care. So they might want to, and often do, supplement the care. So that's what Lisette was talking about. So they would say, I'd like to ask Lisette to come in and see what she could do to help my mom or my dad stay at home as long as possible, because that's exactly what we want in society people to do. We don't want people to have to go into long-term care.
No.
Nobody wants to be institutionalized. Our research tells us that 93% of Ontarians say they want to stay at home.
Yeah.
They want to receive care at home, and they want to end their lives at home.
Right.
And that's another important part of what home care does. We do a lot of what we call palliative care, which is end-of-life care.
Mm-hmm.
And that can be very complex, because somebody could have a very complex cancer or something like that. That is often managed at home, because palliative care is not acute, right? Palliative care is pain and symptom control.
Yeah.
It's not preventive, and it's not going to change the course of the life that this person's life is ending. But they still need to be cared for in lots of other ways, to be bathed, to have comfort measures. And so you might say, my mom is getting exhausted. I need to bring in some care to support my mom, right? It's the whole family that needs to be supported then. And so that's where I might choose to say, I need to talk to one of the organizations, and there's many of them all over the province, that will deliver that kind of care. Personal support, nursing. They have nurses, and they usually work with personal support workers and home support workers who help the family and help the patient to stay at home for as long as possible. And a lot of people think that so many Ontarians are, when they get elderly, go into long-term care. The stats on that actually are that about 6 to 7% of Ontarians end their lives in long-term care.
Wow.
The majority of Ontarians end their lives in the home setting.
Wow.
So
Wow.
yes,
I didn't know that.
It's an incredible belief that we have, that everybody goes to long-term care. The majority of people end their days in the community. Sadly, some people end the last 2 or 3 weeks of their lives in acute care. And maybe that is not always necessary. People can be palliated at home.
And
And
dignity.
we do not need to have our loved ones ending their lives in an acute care setting, which is really not conducive to good palliative care. And I've been a palliative care social worker too. So I've seen great home end of life at home. It's a far, far better environment to end your life. It's gentle, it's quiet. You're not going to the hospital and sitting in uncomfortable chairs. I think the hospital does a great job trying to make it home-like, but it's not. And if you have support around you, whether it's publicly funded or whether it's family funded, with the support of your family doctor, your priest, if you have a priest or a minister or friends or family, that is such an important role that we play. And we need to do more of that as we go forward.
So just a question too, what triggers, so somebody's at home right now, they're in a crisis, they're going to call 911, but say they're not at that point yet, but who triggers all this? How do you begin the process? Is it up to the individual? Is it the family doctor? And how do you know who to reach out to? Should they be calling you? And that's where it starts, or it's just so confusing to know as a member of the public. Like, I'm at home and I'm having trouble my day-to-day life. So how does anybody find out about that?
Yes. Well, often when it's triggered by a fall. So for an elderly person, let's put it that way. So for that type of patient, an elderly person, let's hope, is wearing their lifeline and they fall and an ambulance does come and take them to the hospital. That is a way. So once you're in the hospital system, that's when the family or you could say, you know, I'm having trouble at home, right? I'm starting to have trouble. The other way it could happen is if a concerned family member takes their mom or dad to the family doctor and says, I'm concerned about my mom or dad. I think they need an assessment by the LHIN.
Oh.
So the LHIN is a very big part of, huge part of the assessment for home and community care services. And so those are sort of two ways that people get into the system. And Lisette, you would know the number of your local LHIN that people have up in the north. Like there are 5 big regions right now, and north is one. So
yeah, we're the Northeast LHIN.
Right. So your listeners would be calling the Northeast LHIN. And what's provided by the organizations that I represent is nursing and personal support and OT, occupational therapy and physiotherapy and social work and dietetics and speech language pathology and personal support workers who do all kinds of very complex care as well as very sort of normal care that if the person had a daughter there or a son or a husband or wife, they might do for themselves.
So if I'm the caregiver for my husband someday, hopefully he's not listening to this,
Yeah.
he's at the point where he needs, I'm giving him all of this support, but I'm overwhelmed. I'm struggling myself to help, and there's not enough help. I'm not accessing enough help. So can I reach out to your organization and you can help me figure out who I should talk to, or like who do I call?
Yeah, I mean, people sometimes do call Home Care Ontario, but we would say, in your area, you have, this is your LHIN, and here are all of your other providers, like Lisette, who also offer care.
Okay.
So, because people have to go back locally, and if those organizations are members of Home Care Ontario, then they are reputable organizations, accredited, and they provide service to Ontarians. So that's what I do. What we do at Home Care Ontario is we really have a membership that we support, and we support our members to get education. We support our members with advocacy. We're constantly advocating to government about helping Ontarians get all kinds of care and getting it from reputable providers, like somebody who's trained and continues to get training about what people need and what's the proper and the right way to care for them. So even something as simple as having a bath, I'm sure Lisette could tell us about what it takes to train somebody to give a bath safely and responsibly. I don't know, Lisette, you probably know all about that.
Well, I mean, we have a great team of caregivers and personal support workers that's what they do on a daily basis. But yeah, it's it has to be done properly, so you're not hurting or injuring, the person you're caring for. And a lot of times these people are frail.
Mm-hmm.
So.
Yeah, and Gwen, I think you've touched on, I mean, we get many calls in the office of people that need help with system navigation and they don't know what questions to ask, and we're guiding them through the home care. I mean, because that's one potential hurdle you can go through is what services can I access? But then the other one is if you're a concerned family caregiver and you have a loved one that you know needs care, but perhaps they're reluctant to care, or they have this pride factor because not everybody is open to home care. Not everybody, because we don't understand it, right? And there is a bit of a stigma attached to home care, you know, that's still out there, right? I mean, Sue, I don't know if you have anything to touch on based off of all the experience that you have, but you know, as a family caregiver, is there any options or tips to talk to our loved ones about home care and it as an option, whether it is publicly funded or family funded? Family funded.
Yeah, I think you touched on something really important, Nikki. I think we're all proud. People are proud. Nobody wants to admit that they can't. I mean, not everybody. Nobody wants to admit that they can't do what they could do before, that they need help. You know, we live in that kind of society, don't we? Where asking for help is a sign, is still seen as a sign of weakness or loss of control, and yet I think it really is a sign of being a real adult and saying, look, I have to truly self-evaluate and say, like, I can't do it all. Even simple things like saying, well, maybe I need to lose, 25 pounds. I'm going to do it by myself. I don't need to go to Weight Watchers or any, program to help me, but you might need some help, right? So it's always about how do we self-evaluate and how do we get over that hurdle of saying, I'm going to ask for care because that is what's going to help me stay independent. Will help me to be independent at home. People aren't going to come away and take me somewhere, because the reality is the whole system wants to see you stay at home. I mean, we should be pulling out the stops as a society to saying, keep this lady at home, keep this couple at home, support them at home.
Well, I think as a taxpayer,
Gwen, your speaker just went off.
hang on a
Gwen,
second.
you're muted yourself.
I'm sorry. I think as a taxpayer, it makes much more sense to keep somebody in their home as long as possible, but with the right support. And like we were talking about before, a lot of it is generational. Like my father in his 90s, wouldn't have asked for help. My sister asked for help on his behalf. But anyway, yeah.
Right. Well, it's often the family member that identifies and supports a person to get that care. And some of it, Nikki, back to your question, is just being a bit of a broken record and keeping on sort of going back to it and gently and compassionately helping somebody see this, reframe this for themselves as a good thing to do, as a smart thing to do in terms of staying in their own homes as long as possible. And also, I think assuring them that home care is a very discreet service. And this is why people don't know, like every day, there's all these personal support workers, like just in communities, night and day and in all kinds of weather. And you don't know. You don't know that person's not just delivering something to your door.
Yeah.
Very discreet, very private, because it's your private business. It's not like we roll up in a big, van or something.
Flashing lights.
Yeah, exactly. Exactly. And often I'll see people, PSWs on my street, and I know there's people getting care. I don't know who, I don't know where. Very private. So that, helps people know that this is something. It's just like going to see your family doctor. That's your private business, right? And it's not something anybody else needs to know about, unless you choose to tell them.
And I think if more people, you know what I mean, understand that there's lots of people, like you were mentioning the stats earlier today that shocked all of us about how many people are at home receiving care, that it does become less stigmatized when you know other people are doing it, right? If you know other people are receiving home care, and they are, then you kind of get this in your mind that it's okay to accept help and to keep you independent at home. This is one option, and it's all about options, right? It's all about, where do you see your aging in place plan, and does this fit in your aging in place plan? And this is option one, and this is option two.
Yeah,
and
that's what we should all be doing.
Exactly, and honoring our loved ones' wishes, right? And what they want to see have happen. So thanks for your tips and your suggestions that you've mentioned here today, and hopefully it gets some of our audience to think a little bit more about options that are available for their loved ones, and maybe even starting that conversation
A little bit earlier.
Yeah, I mean, Lisette and I, we see all different kinds of stories that happen, and we definitely want people to be proactive,
not reactive,
instead of reactive.
Well, it's all about education, and we learned a lot today. And
yes,
I mean, the more we know, the better we'll be able to handle all, as we age, right? We all are. I wish I could hold it off, but
no, I'm getting younger.
Yeah, me too, Nikki.
Sure, Nikki.
Oh, no, that's great.
That's funny.
Oh, well, yeah, no. Is there any final thoughts you have, Sue? Any other tidbits of information that you feel our viewers should know before we wrap up today's episode?
Well, I just think people need to know that we have a very big, broad system that could get bigger and needs to get bigger as our demographics change. And you were saying that, Gwen, in a few years, 1 in 4 Ontarians will be over the age of 65.
Wow.
And we'll have all kinds of personal health problems and challenges. And we should all be planning to keep living our best lives in our own homes and communities for as long as we possibly can, up to and including end of life. So there's no reason that people have to suffer alone. There is a burgeoning home and community care system that's only going to grow as time changes. So I would just say to everybody who's listening, just be aware of the fact that there's services out there, lots of them, and knowledgeable people like Lisette who can help and who can do a lot to help us stay independent, which is what we all want to do at the end of the day.
Yeah, that's great.
Perfect.
Thank you.
Well, thank you from all of us here at Aging in Action for chatting with us today. We appreciate all your feedback. And we always like educating our community here in the North and help them age in action.
Thank you so much.
Thank you very much.
Thank you, Nikki, for the invitation.
Yeah, that's great.
Thank you.
Thanks so much. Take care, ladies.
Take care.
Bye-bye now.
Bye.
Bye.
Bye.